Good morning, good afternoon, and good evening. Welcome to the webinar entitled Further Collaboration in the Healthcare Sector between Vietnam and Japan. This is the first event jointly organized by Medical Exchange Japan and ERIA, which stands for Economic Research Institute for the ASEAN and East Asia. My name is Hiroki Nakatani, Senior Advisor to the ERIA, and panelists also participating from many places: Vietnam, Japan, particularly Himeji, Japan, Tokyo, and Kyoto. Before starting, I have two housekeeping announcements. One is questions. If you have questions, please post by using chat or Q&A box on this Zoom mechanism. But please note that if there is too many questions, only some of them can be answered due to time limitation. Second, this webinar is recorded, the whole session, and stream in video on demand later. The audience wouldn't be shown on the screen, so please relax and wear a mask or remove the mask as you wish. So let us move forward. First, according to program, I would like to invite Dr. Minoru Akiyama, Executive Director of Medical Exchange Japan, and representing co-organizer of MEJ and the ERIA. He is going to make opening remarks. May I invite Dr. Akiyama to start?
Okay, thank you very much for your introduction, Dr. Nakatani. And Dr. Nguyen Chun Song, Vice Minister, Minister of Health, Vietnam. Dr. Takeshi Kasai, Secretary General of WHO Western Pacific Region. Dr. Chang T. Zhang Huan, Director of Program for Disease Control, WHO Bureau. Distinguished participants from Minister of Health, Vietnam, Minister of Economy, Trade and Industry of Japan, ladies and gentlemen. Thank you very much for joining us today. I'm Minoru Akiyama, Executive Director of Medical Exchange Japan. We would have liked to hold face-to-face seminar, but because of COVID-19 pandemic, we should organize it as webinar. However, I'm honored to see you even through the screen. I used to work in Vietnam for more than 80 years as a JICA expert, and I used to work in Vietnam and to cooperate in the healthcare and medical fields. So it's my pleasure to make opening remarks today. Medical Exchange Japan and the Economic Research Institute for ASEAN and East Asia organized this conference as a side event of WHO Bureau annual meeting, because of the importance of Japan-Vietnam cooperation in the health and the medical care field. Fortunately, WHO Bureau kindly gave us this opportunity. The objectives of this meeting are to identify medium to long-term healthcare problems that should be tackled by both countries in future, based on the Japan-Vietnam Healthcare Memorandum of Understanding concluded in 2019, and to establish a system to resolve such issues by collaboration of the industry, academia, and the medical institutions, in addition to the governmental cooperation. Since its establishment in 2011, Medical Exchange Japan, an industry government academia collaborative organization in Japan, has been promoting the establishment of international healthcare hubs, conducting demonstration projects related to outbound and inbound businesses as Minister of Economy, Trade and Industry projects, supporting companies and medical institutions, and arranging environment for international healthcare contributions under the government's endorsement of international healthcare. Medical Excellence Japan advocate the realization of patient-centered rational medical care, and we are currently creating a structure that allows people to enjoy health and longevity through the result of mutual collaboration between nations rather than competition. As a result, we believe that industry, government, academia, and the medical institutions collaboration will lead to the development of highly transparent medical care and the health industry. And we hope to support the mutual development of medical care and the industrial growth by making use of the characteristics at the hub of industry, academia, medical institutions collaboration endorsed by the government. We have learned a lot through the COVID-19 pandemic, which is currently a huge problem for both Japan and Vietnam. We must build a system for the people of each country to receive fair and fair medical care as much as possible. To achieve that, we need to consider how we can provide patient-centered rational medical care in each country based on the concept of regulatory science. However, healthcare reform cannot be achieved in a single country. Thus, international cooperation become more important to realize patient-centered rational medical care. In response to this idea, I hope Medical Excellence Vietnam will be established in Vietnam in the future as an organization that can contribute to the global healthcare with Medical Excellence Japan, so that various problems in the healthcare field in both countries can be resolved through the industry, government, academia, and the medical institutions cooperation. I'm really expecting this meeting to become the memorable one, the first step of cooperation. Thank you very much for your attention. Thank you very much.
Thank you, Dr. Akiyama, for your opening address. We are very privileged to have two prominent keynote speakers tonight. Dr. Takeshi Kasai, WHO Regional Director for the Western Pacific, and also His Excellency Dr. Nguyen Tron Son, Vice Minister of Ministry of Health, Vietnam. Their bios are available electronically on the web, so you can refer their brilliant careers in global health and own national health. Then, may I invite Dr. Kasai to start his keynote address. Dr. Kasai, floor is yours.
Thank you very much, Professor Nakatani. It is my great pleasure to be invited to this healthcare dialogue between Japan and Vietnam, organized by Medical Excellence Japan and the Economic Research Institute for ASEAN and East Asia. Excellency Vice Minister Nguyen Tron Son, it's so nice to see you in this conference. I had served as the WHO representative for Vietnam and lived 2.5 years with my family in Hanoi. Not so long, but I was able to visit more than 50 provinces and learn a lot. Vietnam is a beautiful country. Can I have the next slide, please? Vietnam has a beautiful country with a beautiful nature and rich culture and kind and capable and good people, and of course, nice food. Actually, when I mentioned to my family that I have to take a new post and to leave Vietnam, my family was so unhappy to me. And I'm so excited to hear that there is a plan to establish a new platform for the collaborations between Vietnam and Japan for healthcare. And I would like to explain the reason why I'm so pleased to hear this effort. First, Vietnam has been making a very dynamic development and its society has been changing. Their strong capacity has been demonstrated in their COVID-19 response. Unfortunately, they faced the challenge with Delta variant, but coming out from the surge with experience and knowledge to respond better for the next surge and preparing for the transitions from eliminations to COVID-19 as an endemic. Unfortunately, they also faced with the challenge of global vaccine shortage, and their vaccine coverage is not high yet, but we've been observing their absorption capacity is very high. And as a result of the successful suppression of COVID-19, they had less allocations compared to the countries with a high number of cases. That's the reason why Vietnam has less access to the vaccine. And I would like to thank the government of Japan who donated vaccines to Vietnam at the time they were desperate to secure vaccines. And now there is a plan for setting up its vaccine production capacity. And I'm looking forward that Vietnam becoming a country to start to supply vaccines in these regions. Next slide, please. After I left Vietnam, I had an opportunity to go back almost every year. And every time I was surprised, since the landscapes keep changing. The development speed is so fast. When I first visited Vietnam in mid-1990s, the GDP per capita was about US $350. And when I participated in the training at the Lung Center in Hanoi in 2000, it was about $400 US. And when I became a WR, the GDP per capita was US $1,200. And now it reached almost $2,700, $2,800. What I was surprised was that the pace of penetration of smartphone and the internet so fast. Thanks to the leadership, the ethnic minorities living in the hard-to-reach mountainous area have mobile phones coverage. All those development brought so many positive elements to the societies, but at the same time, many challenges for the health sector surface. I have listed there, but because of the time, I will leave these discussions to the panel following my speech. And to overcome those challenges, I strongly believe Japan's experience and technology can be a great help. And I think this new platform facilitates the exchange of those experience and technologies. Next slide, please. The second reason is now Japan side. Japan is also facing huge challenges, including redesigning the society with a plan for 100 years of life. And Japan has now been exploring the future that no other countries around the world has seen yet. When I started working at the remote village in Iwate Prefecture in Japan about 30 years ago, the proportion of the old people was about 12%, but now it reached 28% and expected to reach about 40% by 2065. Medical expenditure as well as the care cost has been increasing accordingly, and now they need to pay attention to healthy life expectancy as well as a financial life expectancy. Japan has been successfully responding to COVID-19, avoiding strong lockdown and being able to deliver their commitment to the world in organizing the Olympic and the Paralympic. But I understand that the COVID-19 surfaced many challenges also in Japan, such as digital transformation and health capacity to respond to the surge. I'm sure Japan will continue to learn and improve its COVID-19 response and address those lessons identified or surfaced under the COVID-19 at the national and subnational level. And I'm sure Japan will continue to explore the new future and ways to transform the society. When they address those challenges, I think diverse perspective would bring great advantage in finding the solution. When I was WR, I arranged a study tour for the Vietnam leaders to Japan to learn about Japan aging. You can see the two photos there. But interestingly, when I accompanied them with the knowledge of Vietnam, actually I was able to see areas that Japan can improve. There are lots of inspiring efforts and discussion that exist in Vietnam, and that could actually stimulate the discussion in Japan. And I think this new platform has a potential to offer an avenue for Japan to learn from Vietnam's perspective. And vice versa, it may give an advantage for the Vietnam to be ahead of the curve by getting the information and observe the discussion ongoing in Japan. The next slide, please. I have mentioned both Vietnam and Japan facing challenges and need to act today to change their future. In our region, we have developed a vision called For the Future. I can confirm that what the two countries have been facing is actually for the many member states. It's about the future for the many member states. For the COVID-19 response in Western Pacific region, regional office, country office, work as one team and connect member states and continuously learn and improve in an effective way. And actually, Japan's earlier observations of 3C is shared through this mechanism, and now it becomes a standard approach in these regions. And I'm very much looking for those platforms that Vietnam and Japan are going to establish would come up with the solutions for each of their country, but those solutions can be a spillover effect to all the member states in our region. Next slide, please. When I was, next slide, please. When I was in Vietnam to play my role as a WR, I don't know how many times I was helped by the Vietnam colleagues, and really thank you very much for that. And I have a deep appreciation for all those people who I met there. I know that when the government of Japan wanted to join WHO in 1951, while there were so many countries who hesitated to support Japan to be back to WHO, it was Vietnam. Vietnam stood up and made an intervention to welcome Japan as one of the members of the Western Pacific region. And I think it will be wonderful if we have a new platform between Japan and Vietnam to address the common challenges such as aging and research and development for goods that are needed in both countries, but can be also a great help for the other member states in the region. I hope this collaboration will give us a fruitful outcomes, and I'm sure there will be, as I mentioned, spillover effect over other countries. I would like to close my speech bringing attention to the photo of the right bottom. When I became RD, we didn't have any international staff from Vietnam, but I'm very happy to report that now I have 5 staff from Vietnam. They are very capable and trusted. And one of them is Dr. Chuan Hon, who used to be a DG in the Ministry of Health, but now she is our Director of Program of Disease Control, and she has been leading the COVID-19 vaccine in the past 20 months. So capable, caring, and deliver what she promised to do so. And I'm also looking for if this platform can create more and more such a capable individuals from both countries who can work for the people around the world. Thank you very much for inviting me to share my perspective on what role Vietnam and Japan can play in this region. Thank you very much.
Thank you, Dr. Kasai, for your encouraging keynote address to both of our countries. And also, I'm very much impressed that you referred Japan's joining WHO 70 years ago. We still remember how grateful we are to the people of Vietnam. And then, may I invite His Excellency Dr. Son, Vice Minister of Ministry of Health, Vietnam. Excellency, you have the floor.
Thank you for Dr. Nakatani. Dear Dr. Takeshi Kasai, WHO Regional Director for the Western Pacific. Dr. Minoru Akiyama, the Executive Director of Medical Excellence Japan. Dr. Hiroki Nakatani, the Senior Advisor to the President of Healthcare Service Economic Research Institute of ASEAN and East Asia area. Dr. Usio, former Health Policy Advisor of Minister of Health, Vietnam. Ladies and gentlemen, today we are very glad to see many old friends in this webinar, such as Dr. Kasai Akiyama, Dr. Usio, my very intimate friend, Dr. Giang Hương, and many friends. First of all, I would like to express our sincere thanks for inviting Vietnam to have a keynote address at the side event on expand collaboration in the medical and healthcare field between Japan and Vietnam, which is organized by the Economic Research Institute for ASEAN and East Asia and Medical Excellence Japan. Vietnam highly appreciates the organization of this important event. Let me take this opportunity to sincerely thank the government and people of Japan for the timely, invaluable, and very meaningful donation of COVID-19 vaccine and medical equipment for Vietnam to control the COVID-19 pandemic in our country. We would like to share with you the strategic orientation of the health sector of Vietnam. In recent years, the health system of Vietnam has been continuously reformed to meet the healthcare needs of the people. The healthcare network has been widely reinforced under the perspective of considering the grassroots healthcare to be the foundation, while the preventive medicine to be the key and help the health worker to be a driving force for the development and improvement of the health service quality, especially for the specialized and high-tech health services. As a result, there are several health indicators of Vietnam which are already higher than those of the country with the similar level of income. The estimated average life expectancy in 2020 was around 73.7 years, witnessing an increase from 2015, those to 73.3 years at that time. The number of the doctor per 10,000 people grew from 8 doctors in 2015 to 9 doctors in 2020, reaching the target. The proportion of the people covered by the health insurance by 2020 reached up to the 19.85%, which was a significant increase compared to the figure in 2050. However, there are still certain difficulty and challenges that Vietnam to have faced, like Dr. Takeshi Kasai already mentioned. Those are the first is the health inequity among the different region and population group. The second is the overcrowding in the big high-level hospital. Third is unavailability of the health system to meet the desired efficiency and effectiveness, especially for the grassroots health network. And fourth, inability of the health system to respond to the healthcare need of population group. And the last is the health system resilience during the COVID-19 pandemic. The strategic orientation of Vietnam health system for the coming year is to comprehensively renovate the health system toward achieving equity, efficiency, development, and quality of the universal healthcare coverage. To increase adaptability and resilience to new challenges, to gain sustainable improvement of the basic health indicator, striving to achieve a high ranking in health indicator compared to the other Asian country and the other country in the Western Pacific region. To achieve this goal, follow the strategic orientation of the health system must be emphasized in each category. The first is preventive medicine and health promotion must be strengthened in order to prevent infectious and non-communicable disease as well as ensure health security. Meanwhile, lessons learned during the combat with COVID-19 pandemic must be replicated to effectively prevent and extinguish epidemic. The second is that the grassroots healthcare must be consolidated and reformed under a new situation, while the breakthrough solution on human resource, professional expertise, financial mechanism, and investment of the grassroots healthcare must be focused on. Universal health management must be enabled, while special attention must be paid for healthcare for the elderly to actively adapt to the aging population. Maternal and child mortality must be continued to be reduced. Child malnutrition must be tackled, while the gap in health indicator among regions must be narrowed. The third is the quality of the healthcare service must be improved, thanks to which to gradually provide comprehensive care for the patient. A number of specialized and high-tech health facilities must be developed on par with advanced countries in the region. To reach with healthcare purpose shall be combined. Telemedicine must be expanded and widely applied so that people across the country have the opportunity to access and utilize high-quality health services at higher level, reducing referral and overcrowding for the high-level facility. The fourth is the comprehensive digital health transformation must be deployed in curative care, preventive care, and health administration. A health information system must be developed to be capable of providing accurate for timely information for healthcare administrators. The fifth, human resources training and development must be renovated comprehensively. The license examination and licensing regulation for health practitioners must be reformed, under which examination center for licensing must be established in accordance with international standard. The operation of the National Medical Council must be promoted, while working conditions and incentive policy of health workers must be improved, especially for those working at the grassroots healthcare in remote, mountainous, difficult area, and in preventive medicine. The sixth is scientific researches must be strengthened, including basic science and applied science in medicine. The application of the achievement of the fourth industrial revolution must be accelerated in the health sector. The seventh is the production of drug, vaccine, and medical equipment must be accelerated, while a control system must be established in accordance with international standards. And the last is the roadmap toward universal health insurance coverage must be performed, while the provider payment mechanism must be renovated. The assessment of health technology must be consolidated to improve the efficiency and mobilize resources, as well as to control the price of drug and medical equipment. Investment in the form of PPP, public-private partnership, must be encouraged. During the process of innovation and development of health sector, Vietnam wishes to strengthen international cooperation, especially to promote the bilateral cooperation with Japan by mobilizing resources and technical assistance, strengthening professional cooperation with school, university, institute, and hospital of Japan. And once again, we would like to invite us to attend for this webinar. And I would like to send to you the good luck and good success for this webinar. Thank you.
Thank you very much, Vice Minister Son, for your very rich keynote address, addressing to current challenges Vietnam faces. We must thank two keynote address speakers, and they are extremely busy due to various commitments they carry, so they may leave now. So let us express our thanks by clapping hands for two excellent speakers. Thank you very much. Then shall we move to panel discussion? This panel is moderated by Dr. Mitsuhiro Ushio. He is presently a director of Hitachinaka Public Health Center and former health policy advisor to Ministry of Health, Vietnam. And this venue of webinar is Himeji City, where a regional committee of the Western Pacific region of WHO is being held. And I learned today that he has another title, that is Goodwill Ambassador or Promotion or Tourism of City of Himeji. So Ambassador, you have the floor, and please moderate the session. Thank you.
Thank you. Thank you so much, Dr. Nakatani. You're very friendly and very interesting introduction of me. Good evening, ladies and gentlemen. My name is Ushio. Xin chào, tôi tên là Ushio. So, I would like to start the panel discussion, but please allow me to say a few words before starting. One is congratulations of successful regional committee meeting in this Himeji City, thanks to the Himeji City and Hyogo Prefecture and the Ministry of Health and Labor at Tokyo and Western Pacific Regional Office. Their effort must be, we'd like to know that. A second is, after I left Vietnam, already 2.5 years has passed, but I'm very glad and very proud to be engaged again for the further collaboration between Japan and Vietnam. So thank you so much. And I would like to thank you so much for ERIA and Dr. Nakatani for your invitation of me as the moderator. So we have 4 speakers on this panelist. Very good balance. 2 are Vietnamese and 2 are Japanese. Now I would like to introduce 4 panelists. Dr. Phan Young Kwon and Mr. Pham Thi Trung Chao. I know her well because I have working with her. And the third is Mr. Yukinori Tominaga. And the fourth is Dr. Koji Wada. He is now very famous because he is always showing in the TV for the COVID. So each presenter will make a presentation about 5 minutes And then if we have time, we would like to have a discussion on the these issues. So number one is Dr. Kui. Let me introduce again. He is now working as the Department of Medical Oncology, Kyoto Min-Iren Central Hospital. So Dr. Kui, floor is yours.
Okay. Can you see my slide?
Okay. Yes, very clear.
Thank you very much for your kind introduction. And I would like to thank all the organizers to give me a chance to explain my thoughts about how to alleviate the burden of cancer in Vietnam. And I would like to have further discussion with many colleagues in Vietnam and Japan, as well as the key person in many other sectors. As you know, Vietnam has already become a middle-income country, and the pattern of morbidity and mortality or the burden of diseases has changed drastically in the last 30 years. As shown in this figure, there was a significant reduction in infectious disease from 26% in 1990 to 12% in 2020, while the prevalence of non-communicable disease has now increased to 77%. Here are the current top 10 causes of death in Vietnam, in which chronic diseases such as cardiovascular disease, diabetes, COPD, and cancer are the most concerned problem. As my major is in oncology, I would like to talk more about the burden of cancer in Vietnam, with more than 182,000 cases newly diagnosed every year, with more than 122,000 of deaths. Since 60% or 70% of cases are diagnosed at a very late stage, the treatment and care plan are usually complicated. We need to care for the disease with combination of therapy and also that integrate palliative care for physical, mental, spiritual pain of the patient. And also we need to support the patient families and so have they go back to work and remain the social connection and many financial issues. I have learned from this online support group belong to our organization, which is voluntarily organized since 2017. We learned that there's a diversity of patient needs that have not been met. We need to do more to reduce the burden of cancer for patients, the family, and for the society. But actually, there's many challenges in Vietnam. As you see, in the hospital, the overload of work, lack of specialists, lack of teamwork and supportive network in and outside the hospital. It's leave the patient alone at home, dealing with fake news and rumors, and they easily drop out of the treatment. The standard treatment is not equally distributed based on the gap in knowledge and poor compliance. So we have confronted many problems in assessing the standard treatment, as well as how to deliver early diagnosis and treatment for patients, as well as prevention, as Dr. Chun Seung has mentioned. Here is some example. It's very surprising for most of you that in Vietnam, cancer screening is wrongly conducted. They use tumor markers, which is not recommended by many society, but mostly used in Vietnam. Whereas the fecal occurrence blood test or ABC screening, popular in Japan for screening of gastric and colon cancer, is not available. We don't have any strategy to deliver that to the community. For treatment, chemotherapy has been denied by many people due to not understanding, due to poor access because of financial problem, or even the government have not approved the new treatment. So basically, we are late comparing to other countries around 7 to 5 years. On the other hand, supplement of fake new treatment, just as herbal, is widely advertised without effective regulation. So I learned from Japan that already control several types of disease successfully, especially the stomach disease, stomach cancer, and liver cancer. And the experience from Japan that I want to share with my colleague and patient in Vietnam is all of those treatments should be evidence-based. And in Japan, we already have data from ASEAN that can be easily applied to Vietnam. And I'm sure that most of them are cost-effective. And because Vietnam is now trying to proceed universal health insurance, I hope that many patients and the community will be beneficial. In Japan, I also see the quality control for high care value, and they try to improve the supportive network for patients. So the advantages of Vietnam are in the young and active population, eager to learn and to help others. And we want to apply innovation and technology in the healthcare system. And as you know, many Vietnamese consider Japan as a role model. So I would like to increase the collaboration between two countries in many areas of intervention and treatment for cancer. Thank you very much for your listening.
Thank you, Dr. Kui. Your nice presentation, especially focused on cancer treatment and prevention. So next panel is Ms. Chow. She is Deputy Director, International Cooperation Department, Ministry of Health, Vietnam. Nice to see you again, Ms. Chow. So
nice to see you, Dr. Usho. Long time no see, and we miss you.
Oh, thank you. Me too. So please start.
Yeah. Good afternoon. So on behalf of the Ministry of Health of Vietnam, I would like to have the presentation on the Vietnam-Japan Health Cooperation. Next slide, please. Yes. As you know that Japan is the largest bilateral donor for the health sector of Vietnam. We can see it very clearly through ODA projects, RAN projects, and technical cooperation. It is a strengthening infrastructure, strengthening capacity for diagnosis and treatment, patient care, hospital management, epidemic prevention and control. And the three biggest hospitals, and these are model corporation of Japan, that is project at 3 central hospitals. It's Bạch Mai, Chợ Rẫy, and Huế Central Hospital. This includes infrastructure and, of course, capacity building. And Dr. Akayama knows very well these projects because he spent a lot of time for these 3 projects. And the other projects are measles and rubella vaccine production project. And next slide, please. And we have projects on regional and provincial hospital development, the handbook on monitoring maternal and child health. And the other is project for capacity development for medical laboratory network on biosafety and examination of highly hazardous infectious pathogens in Vietnam. And we have scholarship from the government of Japan through JICA, that is short-term and long-term training programs for Vietnamese medical staff. Next, please. And we all know that in 2019 and 2020, the COVID-19 outbreak in Vietnam and around the world, and Japan was one of the countries support vaccines and medical equipment for Vietnam to prevent the pandemic. So we have received 4 million doses of AstraZeneca COVID-19 vaccines, and the project to provide medical equipment for the 4 hospitals had been developed and implemented very quickly. And we have the supported cold chain and personal protective equipment and PCR machines. Next, please. And we all know that with the support of Japan, Japan has a lot of strong points, and we can see very clearly that one of those is the non-communicable diseases. For example, cancer treatments and health checkup, medical checkup, and aging population, healthcare for elderly. And the other is application of information and technology in healthcare, such as one of the priority of Vietnam in the near future. Next, please. So when looking at the strong points of Japan, we would like to propose some areas of cooperation in the future with Japan. First, I think that NCD and CD prevention and control is one of the top priority. And to prevent and control of the pandemic, vaccine research and development and production is one of the priority, including COVID-19 vaccines. And pharmaceuticals, like cancer drugs or COVID-19 drugs, is one of the priority, and aging population or healthcare for the elderly. And now the General Department of Population and Family Planning is a focal point for this issue of the Ministry of Health. And we hope that in the near future, Japan can provide more support, including technical and financial support for the General Department of Population and Family Planning to conduct a lot of activity to improve the health of the people, especially the elderly. Yeah. And strengthening bilateral cooperation, now we can switch or turn between Vietnamese and Japan university, research institutes, or health facilities. To participate this site event today, we have here representatives from universities like Hanoi Medical University, Medical and Pharmaceutical University in Ho Chi Minh, and some research institutes like Hanoi Health Policy and Strategy Institute, and some hospital like K Hospital, My Hospital, and others, and related health facilities. And I think that in the near future, a bilateral cooperation between health facilities is a good cooperation between the general cooperation with between the two ministries, I mean Japan and Vietnam. So that's all of my presentation, and I would like to hear your feedback on this issue. Thank you very much.
Thank you so much. Already you prepared a very concrete idea of further cooperation between Japan and Vietnam. And this is the issue that we are going to establish the medical excellence in Japan. We need some platform to discuss which has a priority area in the cooperation between two countries. So in that sense, I think your proposal is very important for our further discussion and implementation. So next speaker is Mr. Tominaga-san. Tominaga-san is chairperson of Japanese Pharmaceutical Alliance in Vietnam. I heard that he was also experienced working in Thailand or other Asian countries for long years. So Tominaga-san, please.
Thank you for introduction of me, Usho Sensei. First of all, good evening, ladies and gentlemen. It is my great pleasure to have an opportunity to talk today's panel. At first, please allow me to introduce JPAV, such as Japanese Pharmaceutical Alliance in Vietnam. We have established this alliance around 5 years ago, and currently we have 26 companies in our member. We aim to aspire contribution to the quality of life in Vietnamese people by cooperating with the Japanese government and also Japan Pharmaceutical Manufacturing Association, which is a JPMA. And we also try to improve our business environment for the development of the healthcare industries. Next slide, please. So this slide shows our collaborations. We usually ask support from Japanese embassy in Vietnam to communicate with the Ministry of Health. In addition to JICA's framework, we have several collaboration projects involved by our member companies. As Ms. Chow already introduced, from 2013 to 2018, there was a technology transfer by Daiichi Sankyo to produce measles and rubella vaccine by Polivac in Hanoi. And the second one is from 2015 to 2016, there was a project by Alfresser for the medical material logistic management system to realize the centralized management outsourcing technology in Ho Chi Minh City. So on the other hand, our access to medicine has certain difficulties, especially for the marketing authorization approvals and renewal of the pharmaceutical product licenses in Vietnam. So there's a popular index called Access to Medicine Index, which assesses and ranks the contribution and achievement to the access to the medicine for the patients. And four companies from Japanese company are ranking top 20 pharmaceutical companies in this index. So it's consists 20%. So therefore, we do believe that we can contribute more of the quality of life to the Vietnamese patients. Next slide, please. So we understand that support from embassy and also JICA framework is very essential for our industry. But also we are highly expecting official framework, a platform to discuss Japanese industry's expectations and difficulties through the ERIA area. And in addition, we are also expecting to hear Vietnamese industry's expectations and also feasible collaborations through this new platform to enhance our opportunities. Thank you very much.
Thank you. Very concise presentation of Tominaga-san. Yes, I remember Polivac vaccine production is one of the most successful projects between Japan and Vietnam. Yes, and your comment is very important because other persons are coming from the academia or institute or university, but your comment is from pharmaceutical. Pharmaceutical company. So, as already mentioned, basic level or basic scheme must be supported by embassy or JICA or ERIA. But in the long run, we are expecting private company, both private company in Vietnam and Japan is also engaged. And in that sense, we are hoping ERIA will be a kind of a platform for that cooperation. Thank you so much for your presentation. So last speaker is Dr. Wada. He was working at Chora Hospital. He is now he came back from the Vietnam. He is now professor of the Department of Public Health, Faculty of Medicine, International University of Health and Welfare. Already mentions, every day he is showing on the TV for the COVID countermeasures in Japan. He is now one of the most famous doctors in Japan now. So, Dr. Wada, please.
Thank you very much, Ushio Sensei. Konbanwa, Shinchao. And I appreciate over 200 participants from Japan, Vietnam, and all over the world. So I'm going to talk about one example of a collaboration between Vietnam and Japan to open the new Ningendok Health Checkup Center in Ho Chi Minh City. So firstly, I just brief my self-introduction. From 2017 to 2018, I worked as a chief advisor for the JICA project in Cho Rai Hospital in Ho Chi Minh City. And after I moved to IUHW, International University on Health and Welfare, I committed myself to a Ningendok, a sophisticated Japanese-style comprehensive health checkup project with Cho Rai Hospital since 2018. It was a big challenge for us because it is not only technical assistance, but also initiating our business for 10 years. So I will talk about how we made this happen together with our Vietnamese colleagues. Next slide, please. So the first slide shows who we are. And our university was established in 1995 in Otawara, Tochigi. As the name of international university shows, the mission of our university includes contribution to the development of health and welfare services internationally. International collaboration was initiated since its founding. Now we are also opened our new medical school with a new concept for contributing to international settings in Narita City. We have welcomed 20 international medical students outside Japan every year and provided medical education in English and Japanese for 6 years. The first batch started in 2017, and there are over 27 students from Vietnam, like Hanoi School of Medicine, Ho Chi Minh City School of Medicine, and Hue Medical School. In April 2023, we expect our first group of medical students to become medical doctors, holding medical license in Japan and hopefully sooner in Vietnam as well. Next slide, please. So this is the building of our Ningendok Center, just in front of Cho Rai Hospital in Ho Chi Minh City. It took a few years, and there were many steps to initiate these services. In May 2015, our university and Cho Rai Hospital agreed to work together for this center. At the time, Dr. Gwen Chon Song was the director of the hospital, and Dr. Song is now attending this meeting as the chief delegate of Vietnam and also the vice minister of Ministry of Health in Vietnam. It took a few years, but finally, during the APEC meeting in Da Nang on 9th November 2017, investment registration has been acknowledged with the attendance by Shinzo Abe, who was the Prime Minister of Japan at the time. And this momentum accelerated the progress of this project. Next slide, please. So we brought CT and MRI developed by Toshiba Medical. They are now called Canon Medical. And our team supported the interior of the center and also the way to treat customers for better hospitalization. And we are also providing the double checking for the diagnosis of CT, MRI, and pathology to ensure the quality. Next slide, please. So we spend a lot of time to start these services, and we sometimes debate for a long time, and we sometimes celebrate Tet Lunar New Year together. And finally, we have over 5,000 customers since we opened this center. And we are recognizing these services have great potential in Vietnam. Next slide, please. And this is the last one. And finally, 3 take-home messages. And the first one is, of course, there are many challenges to implement the project. And people in Vietnam may enjoy many benefits from the services developed and supported by Japan for healthy aging and preventing NCDs. And the collaboration among private institutions can also induce synergetic effects in improving healthcare services in Vietnam. Thank you very much.
Thank you so much for Dr. Wada. And so thank you so much for all four presenters for your presentation. So now we would like to start the discussion, but time is limited. On my desk, there are some questions from maybe from Japanese audience. One is very interesting one is patient safety and health quality are priority in Vietnam or not? I think this is, of course, yes, priority is very high in Vietnam. But another comment or question is, what lesson of Vietnam can be applied to Japan? I'm not so sure what is your comment. But before answering to these questions, I would like to ask you, both of you, because Dr. Kui mentions cancer is one of the candidate field of the both population because of the disease structure is changing in Vietnam very rapidly. You are now facing the non-communicable disease, especially in the cancer, is very important for treatment. I understand well because when I was working with Vietnam, many people asking me what treatment is gained from Japan or what hospital is good in Vietnam. And also, this is one good example of 6 years ago, I'm suffering from stomach cancer and I have surgical operation, but I have survived 6 years now. So one of the suggestions, Dr. Kui's suggestion, the cancer. So Ms. Chow's suggestion is that you have already proposed several areas of cooperation between Japan and Vietnam, especially pharmaceutical area or research between university and institutions. This is very nice. And Mr. Tominaga is focused on the pharmaceutical cooperation and harmonization between Vietnam and Japan. And Dr. Wada especially mentioned for the Ningen doc. It's a non-communicable disease health ticket. So I would like to ask four panelists, what do you think is a more suitable field to start collaboration between Japan and Vietnam? So Dr. Kui, please.
Well, thank you very much for your question. Actually, I've think about this several days ago, and I think that one of the most fruitful fields to collaborate is to target the aging population. Because as you know, Japan is dealing with increased number of elderly and need more caregivers. And whereas in Vietnam, we have a young population who would like to learn the basic and standard cares for the elderly, and which in turn, they will come back to Vietnam several years ago and to serve the community there. As you know, there's 10 to 12% of the population is aging. So I think aging is a main concern for the both countries.
Thank you. How about Ms. Cho? Ms. Cho?
Thank you. And I agree with Dr. Kui that aging population is one of the top priority for the cooperation between Vietnam and Japan. Yes, because as Dr. Kui has mentioned that now aging population is increased in Vietnam is also, and we have to face with the difficulty of lacking of the maybe workforce and the increase of the elderly. So to take care of the health of the elderly is one of the big priority of the government of Vietnam.
Thank you. How about Mr. Tominaga-san? It's also very interesting issues for pharmaceutical companies because of they need so many medicines.
Of course, as for the industry, we understand that there's a therapeutic area which we can get more collaborations, especially for the cancer and also the geriatric, like elderly care. But on the other hand, also as an industry, we also can expect the collaborations by taking advantages of the each other, like Vietnam and Japan. For example, like production capability of Vietnamese companies and also technology capability of Japanese companies. So in terms of the manufacturing, we also have certain collaborations apart from these kind of therapeutic areas.
Okay.
Thank you.
Okay, thank you. You have any idea, Dr. Wada?
Yes, thank you. So there may be a lot of potentials to collaborate between Japan and Vietnam, and but it also depending on who make an initiative in Vietnamese side. And in this project, which we contributed, was Vietnamese side really wanted to implement, and then we have achieved very good progress, and also finally opened the services. So the Ningen doc is one option, but the other is elderly care or some other, even for the improving the quality of the surgery is also really demanding in Vietnam. So, but it's really depending on who are going to take initiative and how we collaborate.
Yeah.
Thank you.
Yeah, thank you so much. Dr. Wada is very comment. But it's very clear that aging population is very, very much important issues, not only Vietnam, but all over the world. And no country has successful outcome for this very big event. So in that sense, good point for in Japan, good point for in Vietnam for aging population. So in that sense, we have some system for age population, so we can share our health systems for especially for aged person. But also, I know that Vietnam has also very good system, very even though traditional in rural area. But we would know the good point in Vietnam. Thank you so much for your comment. So now we have one question from Vietnam, maybe Vietnam audience. Any new business and investment trend among Japanese business in Vietnam health sector? Any new business and investment trend among Japanese business in Vietnam health sectors? I don't know who is a suitable person, Mr. Tominaga or Dr. Wada can give us some information. Any new business or investment trend among Japanese business in Vietnam?
From pharmaceutical industry point of view, Vietnamese market is actually reached to $6 billion. So it's a very attractive market for our industry. And also the medical insurance system is very well established in Vietnam. So we, as a Japanese company, we have more interest to more investment in Vietnamese market.
I see. Thank you. You have any comment, Dr. Wada?
Yes. Based on my experience in Chorai Hospital and improving the quality of medical care in Vietnam, there are certain demands to have the Japanese product, especially for the consumables for the treatment. But usually the cost is a little bit higher than the other products from India, Korea, and China. But the quality is really good. So we may need to have a really good dialogue with medical doctors and also the Ministry of Health to introduce our technologies in Japan to Vietnam.
Okay, thank you so much. So now there are many other issues like already Vice Minister Dr. Son explained what the issues for the Vietnam. We have to, Vietnam people have to tackle each issues, and same issues we have also in Japan, but we have experience for some good merit point, especially for the 8th person. But anyway, when starting this something between Japan and Vietnam, we need some platform to discuss, thinking of priority and urgent issues and so on, based on the past experience, because we have long histories of collaboration between Japan and Vietnam, especially mainly through JICA. But we would like to expand more, not only JICA, through the JICA, but through platform established by JICA, pharmaceutical company or universities and institutions. This is our dream of the further cooperation of medical excellence in Vietnam. So thank you so much for for presenters. Because of the time constraint, I couldn't deepen more discussion, but we would like to finish now our panel discussions. Thank you. So floor is to turn to Dr. Nakatani.
Thank you very much. I think this time, we would like to be benefited by the presence of Dr. Fong, a former director of International Cooperation Department at Ministry of Health of Vietnam, and also now leadership positions in Western Pacific Regional Office of WHO as Director of Divisional Programs for Disease Control. That is exactly what we are talking about. So shall we invite Dr. Fong to give us your advice and guidance? Thank you. Floor is yours.
Thank you. Okay, so first of all, thank you very much for your kind words, Professor Nakatani. And good evening, konbanwa to the colleagues from Japan and Vietnam. It's my great pleasure to participate in the healthcare dialogue on future collaboration in the healthcare sector between Japan and Vietnam. In the sidelight of the 72nd session of the WHO Regional Committee meetings for the Western Pacific, health year in the beautiful and historical Himeji city of Japan. It's also my great pleasure to meet all of our close friends to the Ministry of Health of Vietnam, Dr. Akiyama and Dr. Wu Xiu, who used to work as the policy advisors to the Ministry of Health of Vietnam. And it's really an evidence of how much the collaboration between the two countries has been established so far. As our colleagues, Ms. Cho already mentioned, we have set up the collaboration between the two countries for more than 50 years now. And even today, we listened to a very interesting story shared by Dr. Nakatani and Dr. Kasai that our collaboration even started earlier since 1951 when Vietnam supported Japan to join WHO. And I also would like to echo what has been mentioned by the Vice Minister of Health of Vietnam and colleagues from Vietnam that as a Vietnamese citizen, we are very grateful for the support of the government and people of Japan to the health sector of Vietnam so far. As the former Director General of International Cooperation Department, we extremely feel that the support was very valuable and beneficial to the healthcare of Vietnamese people. And it's highlighted by three biggest hospital projects in three regions of the countries, including Bạch Mai Hospital, Chieu Rai Hospital, and Hue Central Hospitals. In terms of the preventive medicines, the support from the Japanese government for the establishment of P3 level laboratory in the National Institute of Hygiene and Epidemiology, together with the measles and rubella production plant, is really the highlight of our collaboration over the past years. And once again, the friends in it is friend indeed. During the COVID-19 pandemic, the fourth wave of Delta virus attacked our country. Our country, the first country who provided the support of the COVID-19 vaccine is Japan. And together with the support of the medical equipment through the stockpile of the WHO Japan stockpile in Singapore, we was able to send the timely medical equipment to support those provinces in the south of Vietnam was heavily hit by the pandemic. So let's move on to the future. With the connection and the strong historical collaboration between Japan and Vietnam as a strong foundation, there are many opportunities for us to further strengthen our partnership. And we just already heard from the panels. Several initiatives has been conducted, and I think, as Dr. Akiyama already mentioned from his opening remarks, the opportunities for enhancing and promoting the collaboration could involve the engagement of three key pillars: the government of the two countries, the academia, and the industry in the health sector. And leveraging these opportunities would support the comprehensive and effective partnership on the win-win collaboration. And Dr. Yoshi also already mentioned, in the past, we was like recipient and donor countries. Now we move to the win-win collaboration and the partnership that the two countries could benefit from our collaborations. So far, many institutions and universities in Japan and Vietnam have established bilateral collaborations. And many Vietnamese health professionals and students have been trained in Japan, and they become the key leader in Vietnam. So they could be acting as a bridge to tighten the relationship between the two countries. I would like to name a few. The universities in Japan that has been working and collaborating closely with Vietnam, including the Tokyo University, Keio University, Nagasaki University, Nagoya International University of Health and Welfare, among many others. From Vietnamese side, we also, today I'm sure many colleagues from Vietnam join this webinar. They are coming from different universities and institutions and hospitals in Vietnam who already contributed to the collaboration between the two countries. And I hope that with this foundation of collaboration, bilateral collaboration with the universities, hospital, and institutions in Vietnam, we could leverage our collaboration in the new height. The industry role is also becoming more and more important, and the representative of the pharmaceutical alliance already mentioned, Vietnam is a huge market for Japan to consider to invest in the future, especially in the therapeutic and pharmaceutical areas. We already have many Japanese companies who work in the field of medical equipment already invested in Vietnam, and we hope that in the future there will be more industrial sectors from Japan's side to participate in and invest in the healthcare sector in Vietnam, including the telemedicine, vaccines, and pharmaceutical products. As our regional director already mentioned in his keynote speech, the two countries are achieving remarkable results in healthcare for its people. However, we are also facing common challenges that aging population, NCDs, emerging infectious diseases, impact of globalization and urbanization, and the health inequities, and the climate change and environmental health. So in WHO, we also, as our dear regional director mentioned, we have worked with member states to leverage our support to countries on our future vision with the 4 thematic priorities. And we see that there are many common challenges and opportunities for the two countries to work together for the better health of our people. So we think that I fully agree with the suggestion from the panelists just mentioned earlier. We have a lot of potential for collaboration in the future. First, on the aging, and our colleagues already mentioned, I fully support this because Japan is an aging country, and we can learn a lot from Japan on these areas. And we already developed the regional framework on the aging for the Western Pacific, that we talk about the social transformation for the aging care, and especially the experience from Japan would be very beneficial for Vietnam. That is the country with the most rapid aging population in Asia Pacific region. Another area is the NCD and NCD management, NCD prevention and control, that Japan has a very good experience. And cancer prevention and control could be one area, but we think that for NCDs, we could learn a lot from Japan. And the model of Ningendok that mentioned by Dr. Wada is an example of how could we learn from Japan experience for early detection of NCDs so that we can have a better management and save lives of people in Vietnam. We also think that the impact of the climate change and environmental health is really impacting the people. And Japan, with the experience on the disaster management, could be very beneficial for Vietnam and other countries in our region to learn from. Last but not least, in terms of industry, we think that both pharmaceutical and medical equipment, together with telemedicine system, could be the future collaboration between the two countries. And we have a lot of room for our collaboration in the future. So going back to my previous role as a DG of International Cooperation, I would like to share with you that the Health Partnership Group platform, which has been established since 2006 by the Ministry of Health to coordinate and manage the support for the health sector of Vietnam, is a mechanism that would ensure the alignment of the support for the Vietnamese, for the needs of Vietnam. I'm sure Dr. Yu Shi is very familiar with this platform, and it is the mechanism that the platform that we can use to start our discussion on the establishment of medical excellence, Vietnam medical excellence in the connection with the Japan medical excellence, so that we can further enhance our collaboration using 3 key pillars: government, academia, and industries. So from the WHO perspective, we are so lucky to have our regional director, who is to be the WHO representative in Vietnam, and he has a deep understanding and strong commitment to support Vietnam as well as other countries in the region. So we hope that WHO will be working closely with Japan and Vietnam in this journey, and it could be the model of collaboration between the two countries could be the successful story for other countries in our region. So I would like to end my intervention by showing you a very short photo slides, all highlighting the collaboration between Japan and Vietnam over the past and looking forward to the future. Thank you very much. Arigatou gozaimasu. Can you show the video?
Thank you very much. I think we are nearly up to the time, but I would like to say a few words before closing this webinar, because this is very important. We started with two keynote addresses, and Dr. Kasai mentioned about how important it is to be collaborative to each other, to help each other, and also our collaboration can help our other part of this region and beyond. And Vice Minister Son identified broad areas of mutually beneficial areas. Then that was further elaborated by Dr. Chow, Madam Chow. And they are vaccines and CDs, including cancer screening, and pharmaceuticals, including COVID-19 vaccines, and strengthening health facilities. And then added area is aging and geriatric care, and also stockpiling. And the important point is university and research and development. My personal experience recently, and a little bit disappointing experience, is that I am a chair of GHIT Fund. We are successful in developing the first urine-based TB diagnostics, which is supposedly help Africans who have co-infection with HIV and tuberculosis. And it was supposedly be produced in Vietnam factory, but that is disappointed. But one good news is that that technology developed is repurposed to a COVID-19 rapid diagnosis. That is very good. Entire factory line was shifted to production of COVID testing, and that is now imported to Japan. So used to be our business model was made in Japan, but now changing to made with Japan in Vietnam, made with Japan and Vietnam. That is important lesson in my view. And there's many opportunities in aging because we like our senior citizens to be healthy and also wealthy and socially connected. That creates a lot of other businesses. Health screening is one example to prevent diseases and how they are financially well kept. So I think bank needs some cognitive functions checking. So that is health technology is used. So all this has broad areas of new business, and that we can collaborate very well. And after hearing this, from area viewpoint, these points, vaccines, NCDs, pharmaceuticals, and strengthening health facilities, aging, stockpiling, and R&D, each is very important subject. And so far as I see in chat and Q&A, there's many questions, many proposals. My solid proposal for the audience and proposal for ourselves is why don't we have some discussion meeting so that we can deepen these subjects. That will be helpful and encouraging to have MEJ type of activities or some structure or functions in Vietnam. That is, I think, Vietnam's side will look at existing mechanism and how this will fit. So we don't create, do not necessarily to create new mechanism, but I think why don't we use infrastructure which Vietnam has been developing, and that has been contributing to remarkable health improvement in Vietnam. So that is perhaps we can conclude that this meeting is very successful by identifying few areas of common concern and the way we move forward. So if it is good as summary, so can I buy me beer myself and conclude this session? And as far as I see, registered persons are something like 370. And I recognize that always more than 250 persons participated. So I think I feel this is big success, and this success is small success for bigger success with Vietnam and Japan. Thank you very much. Let us close this webinar. Thank you very much.